Hello students. Welcome to part 2 of the assessment of the renal urinary system. In the previous video, in part 1, we were talking about some important concepts that I want you to remember, right? Where is it? Okay, so it's the vascular and tubular components of the nephron. I told you that I really appreciate if you know the definition of the glomerulus and the location. It's very important. Also the Bowman capsule, right? Because it's associated to the glomerular filtration rate. The loop of Henle, the importance of regulation of water balance. Okay, those are concepts that I really want you to remember. The tubular reabsorption is the second process in urine formation, right? So that's also very important to remember, okay? And glomerular filtration is the first process in urine formation. So glomerular filtration is the first process. Then you have tubular reabsorption is the second process in urine formation. And tubular reabsorption of mode of the filtrate early urine keeps normal urine output at 1 to 3 liters per day and prevents dehydration. So when you see the patients urinating more frequently and they are losing a lot of urine, something probably is wrong in this stage, right? Now, the tubules return about 99% of filtered water back into the body. That's why it's so important. Most water reabsorption occurs in the proximal convoluted tube. Water reabsorption continues as the filtrate flows down the descending loop of Henle. The thin and thick segments of the ascending tubule, loop of Henle, are not permeable to water and no water reabsorption occurs here. So let me repeat this because it's important. The thin and thick segments of the ascending loop of Henle, okay, are not permeable to water and no water reabsorption occurs here. This is a very important definition. The distal convoluted tubule, the DCT, can be permeable to water and some water reabsorption occurs as the filtrate continues to flow through the tubule. Okay, another important concept, the membrane of the distal convoluted tubule may be made more permeable to water when vasopressin antidiuretic hormone, the vasopressin antidiuretic hormone, and aldosterone are present. Vasopressin increases tubular permeability to water, allowing water to leave the tubule and be reabsorbed into the capillaries. Vasopressin also increases arterial constriction. Arterial constriction alters blood pressure, which then affects the amount of fluid and particles that exit glomerular capillaries. Aldosterone promotes the reabsorption of sodium in the distal convoluted tubules. Water reabsorption occurs as a result of the movement of sodium. Where sodium goes, water follows. Where sodium goes, water follows. So also, make sure you know the difference between the aldosterone and the vasopressin, which is your antidiuretic hormone. That's important. The ability of the kidneys to vary the volume of concentration of urine helps regulate water balance regardless of fluid intake. In this way, the healthy kidney can prevent dehydration when fluid intake is low and can prevent circulatory overflow when fluid intake is high. In addition to water, electrolytes are reabsorbed as needed to maintain fluid and electrolyte balance in the blood. Most sodium chloride and water reabsorption occurs in the proximal convoluted tube, and the collecting ducts are the other side of sodium chloride and water reabsorption. Here, reabsorption is caused by aldosterone. Potassium is mostly reabsorbed in the PCT, the proximal convoluted tubule, and thick segment of the loop of Henle. So also make sure you understand what part of the loop of Henle absorbs sodium and what part absorbs the potassium. That's important. Okay, I understand potassium is reabsorbed in the ascendant part of the loop of Henle, while sodium is related to the descendant part. Okay, so that's important to differentiate, right? Okay, so now we are going to bicarbonate, calcium, and phosphate are mostly reabsorbed in the proximal convoluted tube. Bicarbonate reabsorption helps acid balance and maintains a normal pH. And we know that bicarbonate, right, is balanced by the kidneys, while CO2 is balanced by the lungs. Okay, blood levels of calcitonin and parathyroid hormones and control calcium balance. Blood levels of calcitonin and parathyroid hormones and control calcium balance. This is related to the kidneys. The kidney reabsorbs some of the glucose filtered from the blood. However, there is a limit to how much glucose the kidney can reabsorb. The point where the kidneys is overwhelmed with glucose and can no longer reabsorb is called the renal threshold or transport maximum for glucose reabsorption. This threshold for glucose is more than 180. And so if a patient is having like 400, is out of the renal threshold, right? And this means that a blood glucose level of 180 or less, all glucose is reabsorbed and returned to the blood. We know glucose present in final urine. When blood glucose levels are greater than 180, some glucose stays in the filtrate and is present in the urine. Normally, almost all glucose and most proteins are reabsorbed, and that's why whenever there is urine analysis and you see presence of glucose, is because the diabetes or the glucose is not under control. Okay? So this is an alarm for diabetic patients. Safety, Action Alert report the presence of glucose or proteins in the urine of a patient undergoing a screening examination to the primary healthcare provider, because this is an abnormal finding and requires further assessment. So more glucose you see in the urine analysis, you have to report to the doctor, meaning that the patient is having glucose that is uncontrolled level of glucose, right? Diabetics. Okay, tubular secretion is the third process of urine formation. We spoke already about two different processes, and allows substances to move from the blood into the urine. Blood into the urine. Here we have the potassium and hydrogen ions are some of the substances moved in this way to maintain fluid and electrolyte balance and acid-base balance. Hormonal functions, the kidney produces renin. We know that renin helps to control the balance of the low blood circulation or low blood pressure. Prostaglandins, erythropoietin, and activated vitamin D. Those are the hormones, right? So the kidneys produces renin, prostaglandins, erythropoietin, and activated vitamin D. I really want you to know also the definitions of that. It's very important. The kidneys also help break down and excrete insulin and many other drugs. So renin, we know what is the activation, the activity. Prostaglandins are produced in the kidney and many other tissues. This produces specifically in the kidney help regulate glomerular filtration, kidney vascular resistance, and renin production. They also increase sodium and water excretion. Erythropoietin is produced and released in response to decreased oxygen in the kidney's blood supply, right? It triggers red blood cell. That's the most important part I want you to remember. Production in the bone marrow. When kidney function is poor, erythropoietin production decreases and anemia results. Okay, that's good to know. Vitamin D activation occurs through a series of steps. Some of these steps take place in the skin when it's exposed to the sunlight, and then more processing occurs in the liver. From there, vitamin D is converted into its active form in the kidney. And that's the bottom line. That is what I really need you to understand. From the vitamin D we take through supplements and sunlight is going to be, that is in the passive form. We need to remember the kidney is going to transform this into the activated form of vitamin D. And this form is needed to absorb calcium in the intestinal tract and regulate calcium balance. So without a good amount of activated vitamin D, calcium It's not going to be absorbed in the intestinal tract and regular calcium balance. Now let's talk about the ureters. Each kidney usually has a single ureter, which is a hollow tube that connects the renal pelvis with the urinary bladder. And the diameter of the ureter narrows in 3 areas. So we are going to skip this part. Kidney hormones and hormones influencing kidney functions. You have this table here is excellent for you to review. I want you to review the renal, prostaglandins, right? That's very important. I want you to remember also erythropoietin, the form of the vitamin D, right? Also aldosterone and vasopressin. Okay, those are the terms that I really want you to remember. And then, okay, and then renin, for example. Okay, let me check this. So we are moving from erythropoietin all the way to aldosterone. Okay, very important. So renin raises blood pressure. Prostaglandins regulate intrarenal blood flow by vasodilation or vasoconstriction. Erythropoietin stimulates bone marrow to make red blood cells. This is not an anatomy exam, so basically what I want you to remember is the action instead of the site, right? The activated vitamin D promotes absorption of calcium in the GI tract because whenever it comes the time that you are reviewing blood work on a patient, in med-surg or ER, you know what's going on. Vasopressin, antidiuretic hormone, your ADH, makes the distal convolute tubes and CD permeable to water to maximize reabsorption and produce a concentrated urine. Aldosterone promotes sodium reabsorption and potassium secretion, because remember the sodium and the potassium has an inverse relationship. Okay, urinary bladder structure. The bladder is a muscular sac that lies directly behind the pubic bone. In men, the bladder is in front of the rectum. In men, the bladder is in front of the rectum. In women, it is in front of the vagina. Okay, that's important. That's important. In women, the bladder is in front of the vagina. And in men, the bladder is in front of the rectum. Okay, now the function stores urine, provides continence, and enables voiding. The secretion of the urothelium lining the bladder resists bacteria. Okay, here you have the graphic of the bladder. And you can see here the prostate gland. This is a graphic in male reproductive, the urinary bladder. Another concept that I want you to remember is continence, is the ability to voluntarily control bladder emptying. It occurs during blooding, filling through the combination of the trusor muscle relaxation, internal sphincter muscle tone, and external sphincter contraction. Yeah, too much. Continence is the ability to voluntarily control bladder emptying, period. As the bladder fills with urine, stretch sensations are transmitted to the spinal sacral nerves. That's important also. Maintaining continence occurs by the interaction of the nerves that control the muscles of the bladder. That's also very important because you can visualize the relationship between these nerves and the spinal cord. The bladder neck. So again, maintaining continence occurs by the interaction of the nerves that control the muscles of the bladder neck, the urethra and pelvic floor, as well as by factors that close the urethra. Micturition, another term that I want you to remember, is the voiding urination. Is a reflex of autonomic control. Also important to remember in relation to the nervous system, right? That triggers contraction of the detrusor muscle closing the ureter at the UV to prevent backflow. Okay, so now at the same time as relaxation of the external sphincter. Okay, voluntary urine elimination, which is voiding, excuse me, occurs as a learned response and is controlled by the cerebral cortex and the brainstem. These are parts that you need to remember. The relationship between the voluntary urine elimination and the cerebral cortex at the brainstem. Contraction of the external sphincter inhibits the micturition reflex by preventing voiding. Okay, urethra. The urethra is a narrow tube line with mucous membrane. Its purpose is to allow urine elimination from the bladder. Right. The urethral meatus or opening is the end point of the urethra. So these are definitions that you need to have clear: micturition, continence, the urethra, also the continence, incontinence, the relationship with the cerebral cortex or the nerves in the spinal cord. Okay, those are very important because depending on the presentation of the patient, you are going to be able to associate if there is any issue in the spinal cord or in the nervous system. Okay, the male urethra has 3 sections: the prostatic urethra, which extends from the bladder through the prostate gland. This is very important. The membranous urethra, which extends from the prostate to the wall of the pelvic floor, and the cavernous urethra, which is external and extend through the length of the penis. Now, kidneys and urinary changes associated with aging. This is always going to be in all my exams. All my exams are going to have questions about the changes associated with aging. So kidney changes occur in the kidney as a result of the aging process that can affect urine elimination and health. Changes in the renal system related to aging are very important to remember, and the kidney loses cortical tissues and nephrons and gets smaller with age as a result of reduced blood flow to the kidney. So changes in the renal system related to aging, we need to remember decrease glomerular filtration rates, right? So we have to monitor hydration. We have to ensure adequate fluid intake. Use caution when administer potentially nephrotoxic agents and drugs, right? Nocturia. Decrease bladder capacity. Encourage the patient to use the toilet, bedpan, or urinary at least every 2 hours. So they are going to, the bladder is going to express very often, right? Respond as soon as possible to the patient's indication to the need of void, yes. Weakened urinary sphincters and shortened urethra in women. Provide thorough perineal care after each voiding. Tendency to retain urine, right? Provide privacy, assistance, and voiding stimulants such as warm water over the perineum as needed. So those are nursing interventions that I'm going to test you about. Blood flow to the kidney declines by about 10% per decade as blood vessels thicken. This means that blood flow to the kidneys is not as adaptive in older adults, leaving nephrons more vulnerable to damage during episodes of either hypotension or hypertension. Now, GFR, glomerular filtration rate, decreases with age. That's part of one of the facts that is listed on the changes related to aging. Tubular changes with aging decrease the ability to concentrate in urine, resulting in urgency. So this urgency is related to tubular changes, a sense of a nearly uncontrollable need to urinate, and nocturnal polyuria, of course. Increased urination at night is going to occur. The regulation of sodium, acids, and bicarbonate is less efficient, along with an age-related impairment in the first mechanism. These changes increase the risk for disturbances of fluid and electrolyte balance, such as dehydration and hypernatremia, increased blood sodium levels in the older adult. Hormonal changes include a decrease in renin secretion, aldosterone levels, and activation of vitamin D. So that's what is very important to check: fluid intake versus urinary output. Okay, and also we have to follow up with blood work very often to see how is the vitamin D levels. Okay, and also check your blood pressure, right? Urinary changes, the urge to void may cause immediate bladder empty because the urinary sphincters lose tone and often become weaker with age. In women, weakened muscles in the pelvic floor shorten the urethra and promote incontinence. In men, an enlarged prostate gland makes starting the urine stream difficult and may cause urinary retention. And this is NCLEX material. This is NCLEX material. Let's go to patient-centered care. African Americans have more rapid age-related decreases in GFR than whites do. And that's also something that you need to remember. Yearly health examinations should include urine analysis, checking of the presence of microalbuminuria, and evaluation of serum creatinine, and that's good to know. We also need to double check the difference between albumin and microalbumin. Okay, there is a table here, the difference between albumin and microalbumin, and the table is coming. So now assessments. Let me see if I can. Microalbumin. Okay, microalbumin. So microalbumin is the presence of very small amounts of albumin in the urine that are not measurable by usual urine analysis procedures. That's microalbuminuria. While albumin is a type of protein that is soluble in water and coagulable by heat. It is found in egg white, milk, and blood serum. Okay, so okay, let's go back to where we were. Microalbumin. Okay, now assessment, patient history. We are going to check the age, the gender, race, and ethnicity, especially in African American. It's important to consider a non-modifiable risk factor in the patient with any kidney or urinary elimination problem. A sudden onset of hypertension in patients older than 50 suggests possible kidney disease. Let me repeat this: a sudden onset of blood pressure, of hypertension, right, on a patient older than 50 is possible. The significant is a possible kidney disease. Polycystic kidney disease typically occurs in patients in their 40s and 50s. In male older than 50 years, altered urine pattern accompany prostate diseases. So we have to check, starting 40 years old, what is the behavior when the male patients go for urination, right? Men rarely have ascending urinary tract infection. Women have a shorter urethra and more commonly develop cystitis, which is a bladder inflammation, most often with infection. Another concept that I really want you to remember, cystitis, because bacteria pass more rarely into the bladder, right? So in women, the urethra is shorter. So that's why the bacteria is going to enter the bladder easily. In men, the urinary tract infection is not as common because urethra is longer. Ask the patient about previous kidney or urologic problems, including tumors, infections, stones, or urologic surgery. It's important to ask. A history of any chronic health problem, especially diabetes mellitus or hypertension, increases the risk for development of kidney disease. Ask the patient about environmental, food, or medication allergies. Exposure to certain contrast media during imaging can harm the kidneys. Ring, ring, important to know. Iodinated contrast medium used for CT scan is associated with both acute or chronic kidney injury. High osmolarity contrast agents can also contribute to kidney function impairment. Okay. Exposure to gadolinium enhanced MRI can result in nephrogenic system fibrosis. Also ask the patient about chemical exposure at the workplace or with hobbies. Exposure to hydrocarbons, gasoline, oil, heavy metals, especially mercury and lead. Can some gases or chlorine or toluene can impair kidney functions? Okay. So it's important to check if the patient has exposure to chemicals at work, right? Or to avoid direct skin contact with this type of chemicals. Use of heroin, cocaine, methamphetamine, ecstasy, and volatile solvents has also been associated with kidney damage. Especially, we have to ask the patient whether he has been told about the presence of protein or albumin in the urine. That's very important. If the urine analysis shows presence of protein or albumin, it's a no-no. The question is, have you ever been told that your blood pressure is high? May prompt a response different from the one to the question, do you have high blood pressure? So let me review this. The question, have you ever been told that your blood pressure is high, may prompt a response different from the one to the, do you have high blood pressure? Okay. Ask women about health problem during pregnancy, proteinuria, high blood pressure, gestational diabetes, urinary tract infections. So we have to ask about chemical or environmental, travel to geographic regions that pose infections, disease risk, recent trauma, injury, a history of altered patterns of urinary elimination. Nutrition, you need to ask about foods and fluid intake, right? Especially fluids with a high calorie or caffeine content, especially fluids with a high calorie or caffeine content. Use this opportunity to teach the patient the importance of drinking sufficient fluid, okay? And cause urine to be dilute. Also, we need to assess for a patient at risk for calculi stones formation who ingests large amounts of protein or has a poor fluid intake. That's why the stones are forming. Ask about any changes in appetite or taste, okay? Ask about if the patient is in thirds very often. If the intake of fluids is different from the urine output. Also, endocrine disorders can cause changes in thirst. Medication history also can impair kidney function. Drugs for diabetes, mellitus, hypertension, cardiac disorders, hormonal disorders, cancer, arthritis, and psychiatric disorders are potential causes of kidney problems. Antibiotics such as gentamicin, gling gling, NCLEX alert, may also cause acute kidney injury. This is important. Let me put this. Gentamicin, okay? Remember that one. Can put the patient in, where is it? Assessment, medication history here. Okay, gentamicin may also cause kidney injury. This is NCLEX alert. Drug-drug interaction and drug contrast media interaction may also lead to kidney dysfunction. You have to check for the past and current use of over-the-counter medication, right? Dietary supplements, vitamin and minerals, herbal supplements, laxative, analgesics, acetaminophen, and of course, NSAIDs. Esto es gentamicin. Is NCLEX alert. This is I've seen this question many times. Okay, and also NSAIDs, okay? Many of these agents affect kidney function and urine elimination. For example, dietary supplements with synthetic creatine used to increase muscle mass. That's another one. That's a big one because everybody's using this type of supplements right now to increase muscle mass. Has been associated with compromised kidney function. High dose or long-term NSAIDs, acetaminophen, has seriously reduced kidney functions. So in general, this paragraph here, from explore to dysfunction, is NCLEX alert. Okay, family history and genetic risk, as whether siblings, parents, or grandparents have had kidney problems. Past term use for kidney disease include bright disease, nephritis, and nephrosis, everything related to the nephrons. Also polycystic kidney disease, which is a genetic disorder, can occur with either gender. Current health problems, you are still in the assessment part, you are asking about everything. Some kidney disorders cause problems in their body systems. So recent upper respiratory problems, achy muscles or joints, heart disease, GI conditions may be related to problems of kidney functions. Okay, any changes in the appearance. So right now you're going to assess the urine characteristic, the color, the odor, the clarity, right? The urine elimination. If the urine is reddish, rust color, brown or black, greenish, we need to report to the PCP. Urine typically has a mild but distinct odor of ammonia. An increase in the intensity of color, a change in the odor, or a decrease in urine clarity may suggest an infection. So also you are going to ask about urinary patterns like incontinence, nocturia, urgency, frequency, burning sensation also, right? Persistent dribbling or leaking of urine is present, and that also will give you some hints about the prostate, right? Renal colic pain may be intermittent or continuous and may occur with pallor, diaphoresis, and hypotension. Another concept that I want you to remember, renal colic, okay? Uremia is a buildup of nitrogenous waste products in the blood from inadequate elimination as a result of kidney failure. Symptoms include anorexia, nausea, and vomiting, muscle cramps, pruritus, itching, fatigue, and lethargy. So we are going to stop here, okay? And when we come back, we are going to get deep into the physical assessment. That's important, okay? Thank you.